My name is Nambangi, and I am the Executive Director of the Minnesota African Women's Association, MAWA. Today we're having the concluding conference for a wider and MAWA collaborative conference, workshop actually, and research on secondhand smoke, the harms of secondhand smoke on African women and girls. And this has been an 18-month-long collaboration funded by the Clearway, Minnesota. And over 200 women were surveyed individually to find out about our exposure to secondhand smoke and for us to also learn about the harms of secondhand smoke. And what was interesting was that we actually did get to learn about the harms of third-hand smoking as well. We got to learn a lot from the women, especially about other social kind of smoking, like in the Somali and Ethiopian communities or Oromo communities. They talked about something called shisha, which they look at strictly as social smoking. It's done through a water pipe. It's fruit-flavored tobacco, but it is equally addictive, and nobody pays attention to that. And most of them were very surprised to learn that it is a problematic thing. We had our first workshop and /summit of African women actually in November, and the turnout was great. The youth from our program, the African Girls Initiative program, mostly Liberian youth and other West African girls from the Brooklyn Park schools, did a play to teach them more about the harms of secondhand smoking. So today's meeting is supposed to be a conclusion. We're supposed to get Dr. Richard Hurt from Mayo Clinic here to do a presentation which explains exactly how smoking gets to be addictive and how secondhand smoke gets to be harmful to anybody in the environment. So we are looking forward to that training by Dr. Richard Hurt. One of the things that surprised us in this training before now is the fact that cigarettes that are sent to Africa are a lot more addictive and a lot higher, because since we tend to buy cigarettes back home by the stick instead of by the box, they make sure that the cigarettes are a lot more addictive so that you have to buy more, you feel like buying more. And these are some of the things that Africans, we really need to learn, because we need to get up and try to put a stop to that kind of practice, just like the communities out here are fighting against. So that's basically what we have learned, and I'm sure Wilder will be very pleased to share the survey results. We are also going to put the survey results up on our website so everybody can have access to a couple of understanding.
Is there going to be a part 2 to this program? Because this is just a survey part where you find out all the information.
Yeah.
Is there going to be a part where you're going to be trying to make changes to the habits or changes to
that depends on the funders, because this funding was for prevention, was for research.
Right.
So if they come up with funding for prevention and other exercises like that, then we can try to do that. But we also have youth, our African, especially West African youth in Brooklyn Park area, that are working in another of our programs called Tobacco Free Youth. And these are 12 to 15 kids working with our staff in collaboration with Northwest Hennepin Human Services. And there are other kids from other groups, so there are like 4 groups together. And what they do is go around the shops in the Brooklyn Park area and try to talk shop owners into making sure that cigarette ads do not target children.
Right.
And so the ways in which the children are targeted, they will say they are not targeting children, but they put the cigarette ad next to the candy so the children see it. They put the cigarette ads at the eye level of little kids so they see it and they look glamorous and they look like it's a wonderful thing, and kids are learning that it's good to smoke.
Right.
So this is some of the work that some of our youth, both boys and girls in the MAWA program, are doing. In Brooklyn Park, the staff person just came if you wanted to find out more about that. But one of the biggest issues that we do have, though, is the fact that when we have all of these programs which are for our own good, our African own good, we don't turn up. We don't turn up, we don't come to hear about it, and when you don't turn up, it looks as if it is not a big deal, your community does not care, and then you don't have the opportunity to get the funding. So if we want to get things done for our community, we also have to learn to turn up when there is an event.
Okay, thank you very much.
I am Thalia Cooper with Wild. Got into a discussion with MAWA in 2007 to discuss doing collaborative work or collaborative research on African women and children's exposure to secondhand smoke. And the discussion came out of our findings from the Clearway African Assistance Program Wilder Research Tobacco Study. And that study was conducted in 2005, looking at smokers and former smokers in Minnesota. And Melissa Nambangi was an advisory member on the committee for that project. So, since very little research has been done, there's very little existing data on African women and children's exposure to secondhand smoke. And Melissa really was concerned that there hadn't been any research done in Minnesota or nationally on this topic. So we agreed to join and apply for a grant from Clearway, Minnesota for a developmental CARA grant to do a study on African men's tobacco use on women and children. And that's how we got started with the project within the African community, and what are some of the things that come out of that to help us to build the next steps, reach the community and get them involved in how to address these concerns facing them with secondhand smoke exposure to African women and children. And really part of the purpose of this research really is to assess the community's readiness to address secondhand smoke exposure. And so today we're presenting some of the findings. First of all, we had to look at preventive health. What kinds of things are African communities doing currently in their communities to address their own health, just health in general. And one thing that came out of that question when we asked them was that it's a brand new concept, preventive health. What are you doing to maintain your health? What are you doing to promote health? Or what are you doing to even just take care of your own self or your family? And some comments made were that it's a new concept. Usually people will wait till a health problem manifests itself or someone dies before they can actually say, oh, something's wrong, or we maybe need to take a look at this, or before people start to talk about it. So, and then we also had to look at comments around culture, because in some cultures, specific health issues are not to be discussed between men and women. And so, and then in many cases it's taboo, because some people feel that, or some communities say that you can't really talk about it because it's not something that you're supposed to be doing, and it's something that may be hidden. So you have to be prepared to have open discussions in, say, community gatherings or in a focus group, or to have actually people come out and talk to you in an interview, and then you feel open to have a conversation and have it public knowledge. And then we can look at the next steps on, okay, how can we increase people's awareness? So there has to be a comfort level amongst people in general, in a community sense, to say, yes, this is an issue, this is a concern, this is a health problem, and we are ready to address it as a community in an open manner.
Thank you very much, Theo.